Well, first of all, welcome everybody to this webinar, which is focusing on some engagement work that took place over the summer with groups of young people who are more likely to be facing health inequalities. We're really delighted to be able to be sharing this work with you all and discuss some of the themes that comes from the young people's feedback and the implications for supporting young people more effectively as we move forward. So thanks so much for your interest, and we're really pleased that you could join us. So my name is Emma Rigby. I am the Chief Executive of the Association for Young People's Health, and I also lead something called the Young People's Health Partnership, and it's the Young People's Health Partnership which has led on this work. We're a partnership of 6 youth and young people's health organisations that work as part of the Health and Wellbeing Alliance to support two-way communication between the voluntary sector and the health system, and I'll tell you a little bit more about that partnership as we go forward. First of all, just to run through how the webinar will work. So you've all absolutely, I can see that you've seen all of the details because you've all clicked on the link at 4 o'clock to join us. So because there's quite a lot of us on the call, your video and audio are turned off and you'll be on mute. And we'll do that to just manage how many people that you can see, so you can change the view and you can see speakers more effectively. We will be recording, in fact we're already recording the webinar, so if there is a comment or a question that you don't want to be recorded, we're very happy to answer those questions after the webinar, so you can contact us via the contact details on the agenda. If you have questions about any aspect of the presentations or about the work, then we really want to be able to respond to them. So please do put those and feel free to introduce yourselves and use the chat for any other relevant chat relating to the webinar. There could be quite a large number of questions and we'll try to answer as many as possible, but if we can't, then we will come back to them, or you can pose them directly to us via Twitter. And then the other thing to say is that we've released the full report from this work, and so Vicky will put the link up now in the chat to the report, and that means that you can find all the detail behind the work and how we did it, which is going to be explained in a more kind of dynamic way via the webinar today. So I think, team, as long as, is that all of the relevant rules? Have I said everything I was meant to be saying? Okay, I've got a thumbs up, which is always good. It's always a bit strange when you're presenting to lots of a blank screen, so it's important to have a bit of feedback. So that is great. So Jeremy, do you want to just give me the first slide, and then I can explain a little bit more about what we do. There we go. So this is just to tell you a little bit about where this work comes from. So as I said, the Association for Young People's Health leads the Young People's Health Partnership, and we represent young people aged 10 to 25, focusing specifically on young people facing health inequalities. We're a consortium of 6 charities, so that is Brook, Street Games, Youth Access, UK Youth, and We Are With You, and we have a network of youth and young people's health sector organisations from across England and beyond. Do you want to go on to the next slide, Jeremy? Thanks. So we're a partnership that's part of the Voluntary and Community Sector Health and Wellbeing Alliance, and there are 21 members in that alliance that represent communities across England who share particular protected characteristics or experience the most significant health inequalities. And this work is absolutely has taken place within the context of that alliance, given the focus that we have had on health inequalities. Okay, so that's a bit of the context. What I'm going to do now is pass over to Rachel, who works for the Association for Young People's Health as our Health Foundation Policy Fellow. And she's going to give us a little bit of context in terms of what are inequalities. And I think that's important in terms of, to ensure that we're talking about the same things, because often we use inequalities, health inequalities and other terms interchangeably. And her work is really looking at that. So over to you, Rachel, and then we'll get on to sharing a bit more about the work after that.
Thanks, Emma. So as Emma mentioned, I've been funded by the Health Foundation to work at AYPH on a 3-year-long programme, specifically looking at health inequalities and how they affect young people. So it's really exciting to have just started that role and be involved in this piece of work, which is specifically looking at that topic and specific groups of young people. So hopefully I can do a really quick overview of what health inequalities are and provide some context to the background of this research. As Emma mentioned, health inequality has become a bit of a buzzword recently, and it's a bit of a hot topic because it's become very well publicised within the media and policy. And I'm sure many of you have already seen different definitions. I've chosen to go with the NHS England one here and kind of expand on what it means and why it's relevant to this piece of work. So health inequalities at its core really describes the differences in health outcomes between individuals and groups. So it's not about one individual or one group having a bad health or bad health outcome. It's about the individual or group having worse or poorer health outcomes in comparison to others, which I think is really important so that we recognise that inequalities are on a scale. It's not just good versus bad. It's about that gradient of experience. So diverging health outcomes along that scale. And I think that's important because then it's about recognising that it's not just impacting one individual, but it's how can we have preventative and important measures that target the whole of the population. And for that reason, that's why health inequalities are unfair, because it is unequal and we should be striving for everyone to have the same level of health. But the good news is that these can be prevented. So if we do have these universal measures which prevent health inequalities. So health inequalities are caused by social and economic inequalities. And these are the resources that enable people to be healthy within society. So it's well known that there's obviously massive differences between income and deprivation across the UK. And we know, as a very simple level, money affords people to lead a healthy life. And obviously there's a lot of stuff happening within the media at the moment about food poverty, and that's really shone a light on this. But it's not just economic inequality that causes these things, it's the social and wider determinants of health as well. So as we've got here, the conditions that we are born in, grow, live and work in. So it's all of those different things. It's the education, quality of employment, jobs, housing, all of the other environmental aspects which impact on your life. And this is what makes health inequalities such an interesting but complex area to work on, because it's not just health that we need to look at, it's every aspect of a person's life. And then when we think of policy, it's not just having policies within that health arena, it's having policies at a whole cross-government, cross-society level. But it's important to note as well that these economic and social factors aren't necessarily means that it will pigeonhole and necessarily determine health. It's kind of not a causal relationship, but an increased likelihood of being in that situation. So it's not about saying to somebody, just because you're in this situation, this will definitely happen to you. So what are the differences in health that we might see? So as we've got here, this is about the different health outcomes. So the mental health, physical health and well-being might be different between different individuals and groups. But it might not be as quite easy to see as that. It might be a more indirect thing. So it might be as not just different health outcomes, but different ways that people are able to access healthcare. So some people might have more barriers to accessing services or treatments. But also different experiences of healthcare as well. So some people might have more dissatisfaction with the service that they receive, and that might be because information is not provided in an accessible format for them to interpret. And also there might be differences in the way that individuals or group engage in potentially risky health behaviours. So some may be more likely to take up things such as alcohol or drugs, which may lead in turn to worse health outcomes later in life. So why is all of this important now? Obviously, we know that COVID has kind of shone a light on unequal health outcomes, particularly for those from ethnic minority groups and those with long-term conditions. But also we know that young people have not necessarily borne the brunt of the burden of disease of COVID, but have had massive societal changes impact upon their lives. So young people have had huge upheavals within education, which has had, we've seen diverging impacts on the attainment gap, and as we've seen, about access to nutritious and free school meals, but also societal changes, so not being able to access peer and support groups in the same ways, which we can see quite acutely with university students at the moment who don't have access to those kinds of peer networks. And also in employment, young people are much more likely to work in sectors that have been impacted by the lockdown, such as retail and hospitality, and are also more likely potentially to be on precarious contracts, such as fixed term, 0-hour contracts. So there's been a lot of evidence that has shown that young people have been more likely to lose their job or be furloughed this year as well. And also young people are more likely to live in precarious housing situations, such as rented accommodation, where they may not have access to outdoor space, or they may be in their parental homes with limited space or a lack of safe space within their parental homes as well. So all of these factors have kind of led to a bit of a culmination of young people having massive change. And it's kind of maybe too early to tell about what the long-term health inequality and health outcomes will be for young people. But right now, we've seen that there's been increases in mental health and anxiety levels among young people, which is often reported as kind of a general look at young people across the board as one homogenous group. But there's not been too much looking at the difference between different groups. And I think that's why this project is really important to, zoom in on those groups and see, have they experienced any particular differences in their situation or health at this time. And it's really important to look at those individuals groups, because even before COVID, we knew that there were certain health inequalities already there. So, for example, the latest census data from 2011 showed that young carers were 7 times more likely than young people who don't provide caring work to report their health as not good. So those health disparities were already there. So it's really important that we keep looking at different groups to see if those health outcomes continue to be disproportionately affected as we move through and beyond the COVID crisis as well. So hopefully that's provided a very quick run through of a very huge topic and good context for the rest of the presentation.
Thanks so much, Rachel. That's brilliant. I think it's really important to start off with the context so that we're all kind of, and I'm sure many of you are working in the field and so are aware of some of those distinctions, but it is really important to remind ourselves, and we're really delighted to have a kind of ongoing programme around health inequalities led by Rachel for the next 3 years to make sure that we're uncovering more and more data, information and feedback from young people on these issues. So thank you so much. So I'm now going to pass over to Jeremy, who's going to lead us through the work. So he's going to tell us a little bit about the methodology for the work that we undertook, the messages from young people, and he's also going to chat to Tom, who is from Richmond Carers, to give us a bit more of a kind of flavour in a conversation about what young carers told us in the project. And I just wanted to flag that also Violet from York Travellers Trust is on the call, and so we'll hopefully hear from others who were involved in the discussion and conversation. So that's what we'll do next. I'll pass over to you, Jeremy.
Thank you very much, Emma. It's very exciting to be here, and it's very exciting to share this with so many people. So first and foremost, thanks for your interest and thanks for sharing your Thursday afternoon with us. My name's Jeremy Sachs. I'm the project manager with healthcare professionals for the Association for Young People's Health. So this project, I led the management and was also lucky enough to lead on the engagement and participation as well, which means I got to have a really fun conversation with the young people that we're going to go through now. So for the next 15 minutes, what I'm going to, in fact, I'm going to time myself so I don't waffle on too much. So for the next 15 minutes, what I'm going to do is talk through a little bit about the methodology and the thinking behind that. Then we're going to look at the questions in the methodology and what the young people told us. Have a chat with Tom, and then I'm going to leave very briefly with the key messages from the young people. All of this I'm going to go over at speed. Vicky's going to tweet out the full report, so do look at that after this. But yeah, so the methodology, AYPH designed the methodology. The questions remained consistent throughout the engagement, but we made sure that the methodology was adaptable. This was so we could change it to respond to the different needs of the different young people taking part. And we felt that it was important to do this to allow the project to reach as many young people as possible, as some of the young people were really open and wanted to work with external facilitators like myself. Some of them didn't mind me being in the room, or the Zoom room, as it were, but wanted actually a facilitator who they'd worked with before and trusted to lead it. And some of the young people wanted to keep the conversations, some of which of the conversations are quite sensitive, sort of in a closed group. So then what happened, this is Violet, who Emma said is on the call, me and Violet would talk after the sessions and she would feed back to me what the young people had said. So in the end, we identified 3 local partners to work with. So the Free to Be Alliance, which is an LGBTQ+ youth service, Richmond Carers Centre, who support young carers, and York Travellers Trust, supporting Gypsy, Traveller and Romani families and young people. We also worked with the RCPCH and us, who supported the engagement work and agreed some of the key messages. We'll hear from them in a bit. What I'm going to do is just share the screen for a sec so we get an idea of the numbers of young people we were working with. So fine. So here we go. So Richmond Carers Centre, I did 2 sessions with. They're 10 to 11-year-olds, and that was a group of 7 young people. Then next, a group of 5 young people, 12 to 15 years old. With York Travellers Trust, what they facilitated internally was an interview with 5 young women aged 15 to 25, and then one-to-one interviews with 7 young men and women aged 14 to 25 years old. The Free to Be Alliance, we put on 1 meeting with 7 young people ranging from 13 to 18 years old. And now to the exciting part of what we asked for young people and the information that they told us. So we started off by asking them very generally, how have young people been affected by the COVID-19 lockdown? And all of them were very quick to say that all young people were affected by the sudden withdrawal of school, of clubs, after school activities, and withdrawal of connection with friends. All of that had had a major impact on young people's well-being, as well as being confined at home when they might not get time to themselves, coupled with the sudden day-to-day restrictions that had been forced upon them. All of this would have affected all young people's well-being negatively. However, when we dig a little bit deeper and we start to have these conversations with these specific young people, we realize that the young people we were talking to, there are slightly more complexities to these different factors. So when we spoke to the Free to Be Alliance, the LGBTQ+ young people, we start to have conversations about what a youth club means to them. And we realized that a youth club isn't just a youth club to them. What it is, it's a place with staff who are specifically trained in LGBTQ issues. They understand the challenges that these young people face, and they're able to advise them, give them support. And it's also a space where they know that they can be safe and free from discrimination. Many of them had stories of living with homophobic or transphobic families, and there was a lot of talk of an increased verbal or physical domestic violence towards families. When we spoke to the young carers, they had an awful lot of stories of not just their own support being removed very, very suddenly, but having to provide more support for the people they were caring for at home. So one young person said, my brother is normally in a residential school, and when he's home, we have a carer come in for the holidays. We didn't have any carers, so it was a lot harder than normal. So this young person was speaking to his experience. Not only was the support he normally gets taken away, but at home he had to provide more support for a sibling. York Travellers Trust echoed these difficulties and added to it, saying that financial stress, as many of the young men in their communities were self-employed and had lost work, and felt that accessing universal credit or receiving financial support was culturally frowned upon and considered shameful. The next question we asked for young people in the methodology was, what have young people's experiences been in accessing healthcare provisions during the COVID-19 lockdown? Again, York Travellers Trust young people told us that they had struggled to manage current healthcare conditions during the lockdown. Digital GP appointments and email prescriptions can be challenging with low literacy levels. One young woman in a workshop said, when people don't know how to read or write, it's hard to get an email prescription. So here we've got one type of digital exclusion, and then with the other youth group, with the Free to Be Alliance, the LGBTQ plus young people gave us another example of digital exclusion when they're saying that those young people may well have the computers or the digital literacy to access support. However, what they didn't have was a safe space to necessarily go talk to that counsellor, talk to that youth worker, talk to the clinicians we normally talk to, because a lot of them were living in homophobic families where there was a real risk of verbal or physical domestic violence. Young carers felt information about shielding during lockdown was inadequate, particularly when compared to the regular broadcasts for the majority of the population. So they felt that the advice for shielding just wasn't there, which meant that they had increased anxiety about going out and what they might be bringing back into the home. One young person said, it did not tell you what you can do and what special measures you would need. The media showed beaches and news flashes and no social distancing, and that makes you worry about how this is going to end. So not only were they not getting the advice that they needed when shielding or when caring for somebody who was shielding, they were also seeing the media and broadcasters showing pictures of crowded beaches, hearing a lot about people not social distancing, and that just ratchets up the anxiety that they were experiencing. So the next question, we asked young people, was what support has been missing or unhelpful? And this was a really interesting point that I'm going to say it, and nobody's going to be surprised by this. But inconsistent communication and information from schools created a huge amount of stress and anxiety. So here was the thing, there's a real split between young people who engaged in schools that not only supported them through exams and their curriculum, but also after school clubs, provided the opportunities for them to be social with their friends. Those young people generally spoke of feeling much better than the young people who engaged with schools that only focused on the academic life. One young person had a story about a teacher who every Friday dressed her dog up in a different outfit, and that was a really sustaining small thing that the teacher did. And the young person found that wonderful, whether the dog was going to be dressed as an elf or a spider. You know, these things really mattered to the young people. Then the young people from York Travellers Trust who wanted to be shielding or wanted to self-quarantine, but in environments where they were being moved on, forced them to break social distancing rules. The next question we asked young people was, what have you had to do to support yourselves? So again, when thinking about what young people have done to support themselves, we know that some young people who are in households that may be unsafe, that is damaging. However, other young people said that proactively connecting with family and friends through games, social media, going for walks could be a very positive way of coping. And again, this question brought up examples of where schools have been very good at being proactive, as well as youth clubs. Other young people did tell us stories about coping strategies that you might not want them to be engaging in, either drugs and alcohol. Interestingly, these young people did link drugs and alcohol to pre-existing mental health issues. And other young people reported developing complicated relationships with food or body image, either comfort eating or worrying about changes to their body through lack of movement. Finally, we asked young people, the NHS is looking to make healthcare more linked up for young people. How could this work best for you? Young people wanted health professionals to prioritise speaking to them first, or at least at the same time as their parents and guardians when talking about their health. If they explain something to you about care you might need, it might make you less nervous, said a young person from Richmond Carers. A lot of young people wanted to know how to access care. So while they wanted to take agency over their own health, they didn't necessarily know how to do that. So they knew that they could make an appointment for the GP, but they didn't know how. They hadn't done that without the support of family members before. And a lot of young people said that they would value being able to speak to healthcare professionals or mental health experts in non-clinical settings, so over Zoom, or being able to access them through youth clubs or through school. So these are very, very broad overviews about what the report says. There's a lot more in there, but I've had to sort of cherry pick some of the really, really dynamic stuff. Now I'm going to introduce as our guest star, Tom. Are you there? There you are, Tom. Hi,
I'm here.
Tom, I don't want to sound like Cilla Black, but who are you and where are you from?
Of course. No, thanks, Jeremy. Yeah, my name's Tom. I work with Richmond Carers Centre. I'm a young carer support worker, so we provide different elements of support, whether it's around emotional advice, respite activities, and social opportunities, and I deliver the mentoring and emotional support side of the service, mainly with the primary age group, and then one of my colleagues covers the secondary.
Excellent, thanks. So we're going to ask Tom 4 questions. I suppose the first one, in context of 2020, why is it important for young carers to be heard, would you say?
Of course, yeah. I think, you've done a really good job there, Jeremy, of kind of painting the picture of what kind of support looks like for young carers, what the impact of caring is, and how COVID has of course kind of impacted them. I think the important thing to note in terms of this year is a lot of the impacts around COVID, such as isolation from social opportunities, isolation from support, having support withdrawn, increased levels of anxiety and worry, and increased levels of care and responsibility. A lot of those impacts are things that young carers face on a daily basis anyway, before a period like this. So you add something like COVID on top of that, and what you see is that carers then are impacted tenfold on those things that are already facing on a daily basis in terms of challenges. So I think the real important bit of giving young carers a platform and making their voice heard is primarily they're the experts in what support they need. So, I can sit here and we can all sit here and talk to a blue in the face about young carers and why it's so important. But actually, young carers know better than anyone what they need. So as services, it's really important that we're listening to them and giving them that platform, because then it sets us up to improve outcomes and support them better.
I certainly agree. And I think, young carers, York Travellers, the Free to Be Alliance are all like shining examples of putting a spotlight on young people as experts in their own care. So I facilitated the 2 workshops with your young people. One of them was for 10 to 12-year-olds, and the other was the 12 to 15-year-olds. And you were at both of those workshops. Did you notice any difference between the age groups?
Yeah, it was quite interesting for us actually, and I think kind of looking back on it and reflecting on it, it was quite surprising, because we all make assumptions about how different age groups are going to respond to certain questions and certain issues, and how things have impacted them. And certainly what we felt is with the older age group, they resonated a little bit more and engaged quite heavily with those emotive topics. So when they would ask questions such as, what messages would you like to give other young carers from your community? It was very emotive for them, and they wanted to make others feel better about their current situations. They're very empathetic towards those facing the same challenges, and it was really interesting to see how they articulated that. I think on the flip side then, the younger ones, which is the bit that surprised us, because we maybe thought that level of understanding maybe quite isn't there yet, but certainly with the younger age group, I think there was an increased level of frustration around maybe that lack of support, or feeling a little bit like it was unfair or forgotten about. So questions such as, kind of what gaps in services, how can we better engage with young carers? That younger age group seemed to resonate with those questions really well, and quite frustrated and really articulate in sharing their views. I think across the age groups, I think the one thing that we were all kind of blown away by, even for us, knowing those young carers and knowing them and working with them on a daily basis, it's just their clarity of thought and how much they do think about these things, and how aware they are of issues that impact upon them, whether it be health, whether it be education. They do have strong views on what is best for them and what they need from us as services and policymakers and professionals. And it was really, really important. And like we said with the first question, I think that kind of really hits home why it's so important to give them that platform. Because when they are given the platform, they do tell us exactly what they need, and they better inform us as professionals. So yeah, it was really interesting to see that difference, and quite surprising, because I think we assumed it might be the reverse, but no, it was definitely helpful for us as a service as well.
Good. I mean, do you think they enjoyed the process of being part of the project?
Yeah, I think enjoy is an interesting word, isn't it? And I think what they did certainly enjoy with the process is, again, being given that platform. I think young carers more often than not feel forgotten about or left behind or not listened to. And they really, really enjoyed having that just kind of experience to speak to you and speak to people and know that people are caring and people are doing something about this, and people want to know what they need in terms of support. I think we had a lot of positive feedback from the young carers that were involved after it. We did a lot of follow-up just to check they were okay, and check the kind of subject matter hadn't impacted on them too much. And just one quote I had from a young carer that I'd been mentoring prior to the consultation we'd done was, and this is a 10-year-old young carer, is that it is nice to know that there are people that are still thinking about children and not just adults, which I think paints quite a poignant picture, particularly with vulnerable young children's group, who quite often feel there isn't enough specific support that takes into account what their needs are. And I think young carers feel that on a daily basis, like I just mentioned. So this whole process for them has really given them an opportunity to have that shared experience with others, like they do get with kind of groups we run on a weekly basis and a monthly basis, but actually to really explore that on a deeper level, like you mentioned earlier, and really kind of pick it apart and how this whole experience has impacted them, to see that other young carers are in the exact same position as them, facing the same challenges, feeling the same frustrations, the same worries. It was a really kind of enjoyable and positive experience for them. So we had nothing but positive feedback post consultation.
Great, thanks very much. And I suppose the last question, when I spoke to young people, when we met, it was dead in the center of summertime. A lot has changed since then. How are your young people feeling about the lockdown now, and how are they feeling about the future?
Yeah, I think it's an interesting one for us, Jeremy, because quite conveniently we're involved in another consultation with another local organisation at the moment, and we did it yesterday. So we've just kind of been approaching the subject again about kind of where they are, how has that impact evolved, what does it look like for them, and kind of looking ahead to the next 6 to 12 months and how they feel about that. And I think the worrying thing is, very much for young carers, is there's been not a huge amount of change in that kind of worry and anxiety. Many young carers are still caring for very vulnerable dependents, or cared for, as we call them. And I think there's still that increased level of anxiety and worry, and even more so now, while they see, I guess the rest of society, starting to kind of get back to normal, or slowly get back to normal when it comes to kind of going back to school. You see restaurants and shops and all this kind of stuff opening up, and life is kind of moving forward. I think the big worry for young carers at the moment is they're kind of being left behind again, because the reality is they're still very much in the middle of it all. They're still very worried. They're worried about how to keep themselves safe. They're worried about how to keep their loved ones safe, particularly those that are vulnerable and are shielding. So there's that kind of balance between, I want to be a child, I want to kind of move forward, I want to enjoy that social opportunity, I want to enjoy going back to school and getting back to what normal life should be. But the reality is there's that kind of overriding worry and anxiety that's stopping them from doing that. And something that one of our young carers said yesterday, which again was quite poignant for us, is it does feel like life is moving on and is moving forward again, when we're very much still stuck in where we were 6 months ago. So I think if you asked them 6 months ago how they were feeling about it, and in terms of the consultation, and you ask them now, the reality is it wouldn't be very different. So I think it's really important that we keep that in mind. Alongside everyone else, we need to start thinking about young carers and other vulnerable young children's groups specifically, to make sure that while everyone is getting advice and general advice, there needs to be something a bit more specific for them, so we can kind of lower that anxiety. On a kind of positive note, what I will say is, and again, just to share another quote, we always try, and I think we did with your consultation as well, finish on a positive note, something we've maybe learned, something good that's happened during lockdown, all this kind of stuff. And something quite poignant that came up yesterday from, again, another 10-year-old young carer, quite young, but something I wanted to share is actually something they've learned is to kind of cherish life and cherish those around us. And I think that gives a picture of exactly who young carers are as a vulnerable young children's group. They're empathetic, they care about those around them, and they really kind of worry about keeping those safe. But at the same time, there's that positive element to caring. You know, they have got that maturity. They are a really, really impressive vulnerable young children's group. And I think it would be a real shame if we got to a point where we weren't listening to them and we weren't kind of giving them those support needs that they are kind of really desperately asking for, which is why it's been, you know, it's such a grateful process for us to be involved and be invited by you guys and for the young carers. So on behalf of them and us, really thank you for having us involved.
Thank you very much, Tom. And I suspect, you know, the young people from the other groups too would be nodding their heads to hear that about young people and understanding the contextual needs of different groups of young people. And it's where that kind of that holistic rhetoric really needs to be applied in sort of reality for that. And lastly, I hope you put the quote "cherish life" on your website.
I think we certainly will, yeah. And I'm sure we've got a whole list of quotes we can cover just from kind of processes like this. But yeah, like you said, I think they're a special young children's group, and I think with the right type of support they can achieve. They can do well, you know, there's no reason they should be hindered, but I think we do just need to start listening to them a little bit more and giving them that platform more and more. And this process for us has just kind of reinforced that idea.
Excellent, thank you very much. So I'm going to very quickly do a whirlwind tour of the key messages from young people. Let me just get this up. So I will say first and foremost that all of this is in the report. I don't want death by PowerPoint at you. This is more just so I can see what we're saying. So what young people really valued was being able to access health services. So young people wanted to take agency over their own health. However, knowing how to do that is where the information was lacking. So our job of empowering young people to take agency over managing their own health. A range of ways to engage, digital engagement, absolutely fantastic, but we need to bear in mind that that doesn't work for all young people. So communicating through telephone, young people would keep posters, flyers, tactile things that we may forget in such a digitally connected age. Clear communication, particularly for young people affected by shielding. So again, there was a real, and Tom's really illustrated it very well, this disconnect from the advice and the policy and the weekly updates that we were getting. That information was not filtering down to the young people. So making sure that young people are able to access this information and that it is in a format that they are able to understand and action when they need to. The importance of social support, so psychosocial support, really, really important in young people sustaining all-round good health. Let's try and remember the teacher who dressed their dog up as different things, as my favorite example of that. Being at home can have a very different impact depending on the young person's circumstances. So throughout this project, we heard really heartwarming stories of young people who were engaging with family, going for walks, playing games, getting out the Ludo and the Monopoly. But then we also heard stories of young people who were in extremely challenging situations. And when we're just talking to a young person on face value, we are not going to know what that looks like. So understanding that that needs to underpin all of our interventions. And again, understanding the broader social determinants and stigma that affect young people. So for young people that we spoke to who face inequalities, the effects of COVID-19 go beyond physical health concerns. There are additional challenges such as economic, work, housing, safety, social well-being, and mental health. Okay, so that is the end of my bit. Emma Rigby, do you want to introduce something else?
Thanks so much, Jeremy and Tom. That was really fantastic. And I think just highlights the importance of, I guess why we did the work and why it's important to hear directly from young people and really take that point of the giving young people a platform, those young people who feel left behind want to feel that people are caring, and that's so important, but also understanding the contextual needs of young people. And it's not, I think we say in the report, we worked with 3 groups of young people. We're very well aware that there are many other groups of young people that we do work with and we would like to work with, but also who you will be working with. And I think understanding all those different contexts is really key. So I am now going to pass over to Emma Sparrow. Emma Sparrow is the engagement manager from the Royal College of Paediatrics and Child Health and leads their engagement work. And RCPCH were really part of this project. They supported the engagement of the 3 local partners. And that was because this specific piece of work fitted in with other bits of work that they were doing around young people's voices during the pandemic. So what we thought it would be really useful to do is for you to hear about those other projects so that you can access the resources and the information that RCPCH and us have been working on. So over to you, Emma Sparrow, and I think Jeremy is going to share the slides.
Yes, thank you. Thank you first though for not only just letting us get involved in that project in the background, but also giving us the opportunity today, because I mean, it's brilliant to see all the different voices come together, and that's kind of the principle of the work that we do as well at RCPCH. So it was nice to be able to share a little bit of this with you really, really quickly, just so that we've got lots of time for question and answers around the experiences of the 3 groups involved in the AYP project. So the next slide just is a little reminder for me visually about the different elements of our project. So for RCPCH, we've been involved in writing and supporting lots of the guidelines for government and position statements, and looking at what does COVID mean for children and young people and symptoms. My side of it was working with as many children and young people as possible to make sure, actually similar to the AYPH project, that we understood what was going on for them. So we had a number of different projects, and I'm really only going to talk about 2, but one that I can see that's come up in the chat already is the fact that we've actually got a portal of all the different studies from children and young people's voice across the country. And I know that there's a couple of health watches that have mentioned that they're about to publish studies. So we're trying to capture all of the different ways that children and young people have shared their experience. So please feel free to send it over and then we can feature it. So for us, it was about, just making sure that we've got somewhere where our doctors and the people writing policy and position statements can see what children and young people have been saying, but then also to distill that down into actually what have different groups, including some of the ones mentioned today, really needed from the COVID services and COVID experience. So the next slide will start off a little bit of information about one of our projects. So we were given a donation from a paediatrician who passed away, so his family gave us a donation to look at something to do with mental health, and it felt like actually it would be really remiss of us not to do that on how are children and young people accessing mental health services during a national crisis. Because as you can understand, that doesn't happen very often, that we're in a national crisis like lockdown, where all services have changed. And we didn't really want to duplicate where there was already studies saying, you know, how has my mental health been impacted? So we really wanted to think about actually what services are you using, what apps are you using, what strategies are you using, and what are the gaps. So across the life of the project, so it was done in about 16 weeks, we had 2 different youth groups that gave us their kind of like recommendations for apps and issues and kind of like gaps that they'd noticed. But we also spoke to doctors to see where they could see that for them it was a little bit different as well, because actually services had changed and reconfigured, and you know, there were some struggles about knowing what was still accessible. We then got Andas young people to review all of that and to, you know, look where there was commonality across all the responses that had come in from all the different local bits of kind of like action research that had been going on. And then the young people from Andas hosted a 2-hour session. So they facilitated the whole thing. They'd never done anything like that, with 4 different groups coming to then look at actually where were there kind of like solutions that could be found that didn't cost money and could be mobilized fairly quickly. So the next slide shows you the main 4 kind of like topics that came up from that assessment of, you know, what are we using right now and what are some of the problems. So for young people seeking mental health support during lockdown, they felt that for some of them that mental health services weren't accessing them through the channels that they were using. So they weren't being able to find what they needed on the social media channels that they were using. They felt at times that some of it was being put on Facebook, and children and young people weren't on Facebook. So it was really about just knowing where they are and then how to get the information to them, which, you know, is something that's come up in the AYPH report as well. That peer support was preferred, but actually that is also really hard to access during a lockdown, but also hard for the people giving peer support to also remain safe and get their support. That there were some challenges around online therapy, not being able to mobilise quickly enough to be able to deliver that. So with people feeling that they weren't sure if their appointments were still running, if they were meant to be phoning up, if someone was going to get in touch, and feeling like there was a little bit of confusion as to how that was going to happen. And then also linking to some of the device concerns, but also then privacy and confidentiality concerns about if it was going to be digital from home. And then, as I mentioned already, that workers didn't all know where to signpost young people to, or there was so much signposting going on that it became overwhelming, because there was 15 different preferred apps or websites, so people didn't really know which one they were supposed to be sharing. At the open session, which is the next slide, we got the young people to really think about, they prioritised which topics they wanted to look at on that list of 4, and then they had to think about what was the impact on children and young people. How could they fix that problem, but also how could they make sure actually that they shared that if it was fixed. So we really took them through a process, and it was interesting doing this online, so bringing together young people that don't know each other to do something which is actually interesting, enjoyable, fun, of an evening when they've already been at school, and then us using different online methods. So through this whole process we've learned so much about different things like Jamboard, which is on the screen, that we can use, or Menti to do votes. So and we're about to do our report, will come out next week, so early November, but it will really highlight some of the things that are actually quick and easy to do. And it really does all come back down to, that won't be a surprise to anyone on this webinar, if we ask children and young people, they have got the answers, and they can tell us where are the best places for them locally to be seeing that information online, and whether they are trusting local support social media sites, or whether they wanted to come through school. So all of them pretty much came down to, you know, speak to young people and get them involved. The next project then, on the next slide, was slightly bigger. This was, we started a COVID book club in July, where we, like I said, we recognised that there was already a huge amount of survey work going on across the country with lots of different children and young people to find out what their experiences or the impact of COVID was. So I think the first study came out within about 3 weeks of lockdown, and by July we'd found 33 different studies that incorporated the voices and views of 70,000 children and young people. At the college, so for the scientific and medical side, we were reviewing journals and published kind of like pieces of work about the medical impact of COVID, and they were being peer reviewed by doctors, and you know, they were helping to sort out kind of like the case definitions. What we wanted to do then was to do the exact same process, but with children and young people reviewing other children and young people's published studies, so that we could really understand what was going on there. But our responsibility is to make sure that actually our doctors know, but also our doctors can then tell the trust boards and the governments that they're working with and the NHS structures. So we got some young people together. We had them work out what training they needed. They actually realised they had quite a lot of the skills themselves. So they taught each other how to use online systems, or how to read documents and write notes. They created templates. One of them is really techie, so created, it's Michael's AI. So Michael created an AI system where we could feed all the reports into, and then it could pick out some of the key words, which was really, really clever. And then they worked on some other things, like the next slide, which is about a live Q&A event. So they recognised that actually a lot of the information, as you've heard already, about shielding, it wasn't for them. They weren't getting information through the press conferences or the press briefings, because one, they weren't allowed to ask questions because they were under 18, so they were barred from that system. But also the information was all going in at adults, and it really felt to them that it was going into the older adults that were most affected. So they created their own live Q&A event where they invited 3 paediatricians, gave them topics to talk about, which you can see on the screen, and then had young people from across the country come and ask questions so that they could understand or really explore some of their concerns and get reassurances, which worked really well. And even though it is, of course, of the time, which was the 30th of July, so the world is different now, it is online, but it's quite an interesting indication about what were some of the concerns, and some of those are still our concerns now. The next slide then shows how the project developed. So they looked at all of the different studies. They did topic time, where they looked at where the common themes were, which you can see on screen. So mental health kept coming up everywhere, the impact for children and people on their education, aspirations, family and relationship dynamics, of course, health needs. Virtual living included that kind of like device insecurity, or not having confidentiality, or not having privacy, or having to share devices, or worrying about sharing data. But also, as we've heard, kind of like the pandemic information. So as you can see on screen, the young people summarised just in a couple of paragraphs what was said across all of the reports that they read. The blue box has got their kind of like book club request. So this is what health services or organisations could be doing. And this is all on our website, and I'll drop the link into the chat in a minute. But then the next slide shows how they distilled that down then for what the NHS was doing at the time, which is writing recovery plans about how, once we're through, you know, how can we start resetting and recovering some of the services. So some of that is about now, some of that will take 6 months, some of that will, you know, go beyond that. But for young people, they said the absolute priority from everything they'd learnt and seen through all the studies was that pandemic information had to be improved urgently, and that had to be done because of winter coming and what that might change around how they accessed health services. That mental health services needed to be ramped up so that actually they could cover the impact of COVID. And that's not for people that just exclusively have lost someone through COVID or had COVID themselves, but it's that loss of hope or aspiration, or, you know, not having had their end of school experience that they expected. And then finally, that we all need to think about how we deliver virtual health services, because there are some challenges, as we've already mentioned, about how everyone can have equal access to a health service if it's virtual, but also how we can empower and encourage young people and children to know that actually they can still request a face-to-face, because that might be right for them. The next slide shows their kind of like product that they created. So for each one of those priorities, they've created a poster that can be just like printed out and put up in organisations, or talked about in team meetings or in creating plans. And it really boils it down to, there's 3 problems for each topic. There are 3 solutions, most of which don't cost that much money, if any, but also that the impact will be what the impact will be on children and young people. So they will feel valued, they will feel listened to, they will understand how to make appropriate health choices during the pandemic. And then there's a little quote and a little stat from the stuff that they've come up with. So the young people have worked really, really hard. They've put in over 100 hours volunteering in about 12 weeks to go through all of these studies. And if we add on the volunteering from the mental health project as well, we're probably looking at about 200, 250 hours in 12 weeks, just to do what we know is important to children and young people, to be heard and to be seen and to be feel like they're also able to be part of the response effort for the pandemic. So that's a really quick rundown of some of the other work that's been going on, and the next slide's just got our contact details in case you want to send any reports that you might have already done. So we'll publish them if it meets the inclusion criteria. We're very fancy, but also where you can find some of our resources, and I'll pop those links into the chat as well. But yeah, thanks for letting me be part of this.
Thanks so much, Emma. That's great. And I guess from our perspective, one of the things that we really try to do in the Young People's Health Partnership is bring together all of the different people who are, or work together with, not bring together, but work together with all of those organisations out there who are bringing together young people's voices and views. And that's partly because we want to share those voices, but also we want to avoid duplication. And I think what this, the reason it was great to have that is because we've got that real kind of macro sense of all of those voices that came from the RCPCH work. And then this work that we've led on has been really drilling down into the real kind of specific micro experiences of three groups of young people that I think both are really important. Yeah, and that's great. Sorry, slightly lost my way there. It's always the way on Zoom. Thanks everyone for presenting. We've now got time for questions and discussion. And as I said at the beginning, we're going to go to the chat. So if you've got a burning question, access the chat and raise it there. If that's really difficult for you, or for some reason you can't do that, feel free to raise your hand, and the way that you do that in Zoom is you click on the participants list, and you can sometimes do that, but, you know, or come off mute if you really need to ask a question. So I am first to a couple of questions that were posed earlier on. Oh, I'm having a problem with phone. Suddenly something happened to my screen. That's not what I wanted to happen. Early on, we had a couple of questions from Healthwatch, and that was really from Healthwatch Birmingham and also from Healthwatch Somerset, about how we, I guess, link together initiatives more effectively, how we can share both kind of results of engagement work that's happening locally, but also maybe some of the solutions. And I don't know if anybody had any particular, I don't know if Emma Sparrow, you had any particular thoughts about that. I guess that is what, from my perspective, that is what we are definitely trying to do both in the Young People's Health Partnership and the Association for Young People's Health. So we will continue to, so we're very happy to be contacted and look at how we can link up in those ways. And I don't know, Emma Sparrow, if you had some reflections on that.
Yeah, I think if anyone has got any experiences from children and young people, that I know, I think it was Birmingham that said that they've got 500 experiences that are about to publish, then definitely send that. So that's what our portal is hoping to do, is to be able to capture some of those so that other people can access them. And we're doing, you know, we're continuing to promote that. I think about the solutions, it's just about getting as connected as you possibly can. But something that our young people learn is that you have to be able to provide solutions that don't cost something, because if every solution costs something, then people switch off instantly. So to always have the range. So RCPCH and us, they all think in no cost, low cost and maximum cost, because we should be aspirational. So again, the same, we've got some space on our website where we're sharing some of that. So, you know, maybe send them to Emma Rigby and also to RCPCH and us, and then we can see where some of the best places are for them to be hosted or shared. Twitter is also the best way to get, you know, anything out there. So if you have done stuff, then, you know, please keep tweeting it. And I know that there's a Twitter network that's been set up around COVID co-production, which has also been quite active. So it's also nice to see where children and people have been actively involved in creating some of those solutions too.
Great. I was just going to ask if Violet from York Travellers Trust is still on the call. I don't know if you're there, Violet. Oh, she is, I think. Just going to check, Violet, if you wanted to come in briefly and say a couple of words about your involvement in the project. Oh, there she is, Violet. Sorry to do this to you, but I just felt like it was just so amazing to work with York Travellers Trust, and I didn't do that directly, but Jeremy has said how important it was, and I just wondered if you wanted to say anything about the work, or particularly the issues that young Gypsy Traveller and Romany people were talking about.
Quickly, apologies if you hear a rumbling in the background. I've got a small person on the floor, and when she hears me start talking, she decides she wants to join in. Really helpful of her.
It's lovely. It's lovely to hear, Violet.
So it was really great to be invited to be involved, and even more so to be involved. And it just felt we as an organisation had kind of forgotten the young people, because we kind of presumed that they were being taken care of by their parents. And what the research helped us to do was to what doing the research helped us with was to sort of put back in our minds that not all young people are part of a family unit, not all young people were being taken care of by their parents in a way that was suitable for them. So it was really, really exciting. It showed us that we were lacking. So if we were lacking, how much more were other service providers lacking as well? And just not realising that we had young people that were 16-year-old, married, expecting babies, and were homeless. Just being able to engage with that young woman and give her a voice, and have others around the table say, yeah, we feel the same, it's not just because your situation. So we had young people that were in houses and older saying, yeah, I felt the same way, actually. It's not just because you're so young and you're homeless that you feel that way. It's COVID and what it's doing to us that's making it feel that way. So it was really, really valuable, and just being able to give those young people a voice and making them feel heard was just amazing, and I really, really appreciate the opportunity.
Thanks so much, Violet. And I think you did a really good demonstration there of how all children and young people can absolutely have a voice in making things better. But also, I think it was really incredibly powerful to hear from the young people that you worked with. And I think you raised an issue, but I think particularly some of the kind of financial impact on young Gypsy Roma Traveller men, and how that was really impacting on their health and well-being. Is something that the report really, really highlights. So thanks so much.
I do think that the mental well-being of the young people will have an impact well past lockdown, because it was just the young women we were speaking to and what they were telling us about what the young men were going through. I can imagine, how that's going to be resolved quickly.
Absolutely, absolutely. So the lasting impact. Thanks, Violet. Thank you so much. Okay, so let's go back to the questions, and Vicky, I'll come to you in a minute. And thanks to Neil from Barts Health has said it's been really useful, and they're going to take these things back to Barts Health, and that's great. And I think Vicky has shared the link to the link to the report in the chat. Okay, now let's go down. So I've got a question from Wendy. Hi, Wendy. So Wendy Nicholson is from Public Health England, and we've done lots of work with Wendy on things like You're Welcome and other areas of work. So her question is, there are some interesting things emerging. If we had to think about lessons learned, what would they be, especially for the second wave? I think that's a fantastic question. Thanks, Wendy. So I think, Jeremy, do you want to come in on that? Yeah.
Yeah, I suppose this isn't so much as sort of nuts and bolts practical, but I think, the whole project was looking at inequalities, and, you get this term sort of banded around of hard to reach young people. And I think, that I don't love that term at all, but I think if you use it, it's if one uses it, it's useful to look at it as a two-way street. It's like, well, if young people are hard to reach, what about our services? Are our services hard to reach for young people? And I think that was a real theme throughout the thing, of young people wanting to take agency over their own health, wanting to know how to manage the situations they were in, but not knowing how. And it's so that's an issue, in a broader sense of how these messages are communicated to the country. But if that is getting lost somewhere, then us as healthcare providers, as charity sector, as clinicians, really thinking about how we are communicating our messages, how we can support young people to them, because I don't think it is a like one way won't fit everybody, you know. And I think certainly in the second wave, whatever's going to happen, if there's another lockdown, if there's localized lockdowns, just thinking about how to get that information to young people in a way that they feel empowered to look after their health is really, really important, and highlighted in what all of the young people in this project is saying. I don't know if anybody has anything sort of practical or sort of, you know, anything else to add to that, but yeah.
Thanks, Jeremy. I've got a couple of other thoughts, I guess. So the Young People's Health Partnership have been involved in working with the health system, with Public Health England and NHS England and the Department of Health and Social Care throughout the pandemic, and young people who are working within the health system. And I guess the first thing would be, I mean, there were absolutely efforts made in the first wave around more kind of joined up and effective communication to children, young people and families. But by the very nature of that first wave, you know, everything was happening, and it was, a shock to the whole system. And I think in the second wave, what I really hope is that we have a more joined up communication strategy out to children, young people and families, and in terms of the kind of messages around the pandemic, what it means for them, and also what they should be doing in relation to isolation or social distancing, etc. And I think then the second thing is really thinking about what are the additional things that we really need to be doing for other subgroups of young people who we know are more likely to be impacted and who don't have family support. So I think what this report kind of stresses is how important out of school and social activities are for young people who don't have access to those things readily, or who are living in more deprived communities, or who are from some of the groups we talk to, and how we get that out via schools or via youth services, I think is really important. So recognising the value of that and ensuring that we provide access to it. And I think certainly those are the two things. So it's a kind of like universal communication to all children, young people and families, and then something specifically about how we're going to target in effort to meet the needs of those most likely to be affected. So I'm sure there are lots more specific things that we could be saying, but those are two that certainly come from the work that we have been doing in this system. So I've got another question. So from School Nursing Service, which is great, following on nicely from Wendy. And this is from Gloucestershire, and they use the Chat Health platform. And so that is promoted by emailing. And the question is suggestions about what we could do differently to promote our services and Chat Health. So I don't know if anybody has a particular reflection on different ways of promoting. You can wave at me. Emma Sparrow, go for it.
So the young people through the book club, they have said that the main thing is to use social media that young people are using. So it is about being on TikTok and Snapchat, which I think for organisations feels really scary, particularly where some organisations haven't even managed to get Twitter approved yet. So it's, I think for anything like that, rather than it being seen as an information governance barrier, it's about working with organisations that have got that approved, that have got that access in, and really building your network locally of providers that are using those platforms that you can work with. So in Central Beds, for example, they had a spike because of a house party. So the council worked with their local youth forum to say, actually, what is the way to get this message out? The young people turned around their own video in 3 hours and had something like, I don't know, 50,000 views by the end of the weekend because of the amount of times it got shared. And actually the personal impact of that video and how it is explained by a young person that's got a sister who's a nurse was so beautiful that it really kind of like challenged that view. So I think, again, going back to, you know, see if we can ask young people what works for them, and if our own systems don't allow us to use TikTok, for example, you know, can we work with children and young people's groups who can use that so that they can understand something like Chat Health and be able to put that message out there. So I think that would be what our the recommendation from the COVID book club was.
Great, thank you, Emma. That's really helpful. I mean, I think one of the reflections is that it is about having, and this comes out in the report, it is about having lots of different ways of communicating something and lots of different ways of accessing, and that's kind of at core what young people were saying to us, and I think what lots of other groups of young people would say. I think the thing about digital access is quite clear and stark in the report, in that actually a lot of young people, as you would expect, said it was really great to be able to access things digitally, and that was really helpful to them and supportive. But for those young people who didn't have access to digital devices, they felt even more excluded. And so I think one of the things that we have to take on board is that not all young people will have access to, that they might have access to a device and might not have great access to the internet, all kinds of, you know, different permutations on that theme. But that, I think, is something that we, particularly related to inequalities, that we really need to be taking seriously, because it's fantastic the steps forward that have been made in digital delivery, but we must make sure that those young people who will be excluded by that aren't further excluded, and I think that's something that is okay. So I think I've got one more question. It's your last chance, everybody, if you've got an there's lots of lovely comments, and thank you for all your feedback. But I am going to come to Veronica and Lynn's question. I don't know, Veronica, if you want to say what organisation you're from, feel free to if you want to. But the challenge that she's said is that it's in reality how good we are as an organisation at hearing what young people are saying about our services. And I guess that's probably a challenge that we all face in different ways, and a really important one. I think posing the question is the first step to getting it right. I don't know if people have any particular reflections on what, you know, organisations can do in terms of moving that forward. If you want to say a bit more, very welcome to come off mute. There's certainly a set of questions around coming off mute and legacy questions that I've learnt by spending the last 6 months on Zoom and Teams. Jeremy, were you going to say something?
No, I'm not sure if we all heard the question. You broke up a little bit.
Oh, okay. Well, thank you for telling me. That's very helpful. So the question is there in the chat. Can you hear me now? Yes. I'm getting nods. So it's about a challenge about, and in reality, about how good we are as an organisation ourselves at hearing what young people are saying about our services.
I mean, I think that is a real challenge, isn't it? And I think at AYPH, I know we certainly talk a lot about engagement versus tokenistic engagement. And it's like, you can talk to young people about what they want, and you say, oh, that's very nice, we've ticked that off, but how do you put that into action throughout whatever the service is, or whatever you're trying to produce, or however you're meeting the needs of young people? And I think that is quite individualistic, depending on the organization that you come through. But I suspect, and it feels like a stuck record or the theme of the day, but it is about keeping those lines of communication open to young people in your communities and who you work with, and making sure that communication is done in an appropriate way, that young people A, understand it, B, that it's safe, depending on what you're dealing with, and then C, keeping young people up to date with the changes that you are going to instigate due to those conversations. And maybe that's what holds us accountable, is this mindset of saying, we're going to have these conversations, and then we're going to keep young people involved by going back to them and saying, this is what we're instigating, you've told us you want this, this is how we're meeting that challenge. I don't know, maybe that's the way, or a sort of a loose roadmap through quite a tricky challenge, which is quite individualistic, I'm not sure.
Thanks, Jeremy. That's really helpful. And I think it's probably different for everybody, but I guess one of the things that we would say from the Young People's Health Partnership is there is a lot of engagement work out there that's been done by RCPCH, by the NHS Youth Forum, by us, by a lot of other youth charities. And so if you're asking a question about what young people in your services feel, one thing to do is to check whether somebody else has asked that question, and whether you can use that information to inform change in your own organisation. And I think the second thing is that there is lots of advice out there in terms of how you can get engagement right. And it can be, for many organisations, a scary thing to do, something that they're very concerned about in terms of the risks of doing it. But I think what we're really passionate about is saying how important, there are huge risks of not doing it, and that actually with a few different bits of support from organisations like ours and the others that have been profiled today, you can absolutely do that. One of the things that we're passionate about is really working in partnership with local charities. So if you're, and we heard from Birmingham and Somerset, and I don't know the geographical reach of where everybody is from today, but there will be local charities in your area who you can work with, who you can commission to do particular pieces of work, who will have trusted relationships with the groups of young people that you really want to hear from. And that is certainly a model that I think is can create a more meaningful engagement process, rather than necessarily having to always establish the systems for yourself. I mentioned the NHS Youth Forum. If you're from an NHS organisation, that exists. And also there are 4 youth representatives and 2 youth experts on the Children and People's Transformation Board in the NHS, who we support together with the NHS team. So there are absolutely those voices there that we need to make sure we engage with. Okay, I'm going to see if there's one final question, and then I'm going to close the meeting. So I want to leave on time. Okay. Yeah, so this is a question from Louise, which is about diversity and the diversity of voice, and that sometimes we can have youth forums or steering groups to generate new ideas, but they sometimes are particularly engaged young people who absolutely need to be heard, but sometimes aren't completely, don't show the diversity of young people in the local area. I don't know if anybody, Jerry, you might have some reflections on that, but or I can.
I mean, short of absolutely agreeing with Louise, I think you put out a call for a youth panel, and you will get young people who are already very engaged with that. And I think that's where, that kind of challenge becomes, and, Violet has messaged as well saying that she completely agrees and has articulated it all better than me. I think that's where you have to be completely proactive in understanding your communities. And I think that needs to be done on certainly a local level, understanding what does diversity mean in your area, and who is in your area providing, and being proactive and reaching out and forming those relationships, and again making sure that's not a tokenistic relationship with these different provisions, and sustaining that. But I think you're absolutely right. If we're not asking ourselves that question, then we are inevitably going to be missing a large proportion of the young people in our local areas and nationally as well.
Yeah, that's really helpful, Jeremy. And Veronica has just given us a really good example in the chat about a kind of model of appointing a peer mentor within the CAMS teams. And I think there are lots of examples of how people are doing that. And I suppose for me, it is about not a one size fits all, that youth panels and youth councils, even if they are really as diverse as we can make them, are not going to be for all young people. And I think, as we showed in this project, there are, the 3 different groups of young people wanted to engage in different ways. And we need to find flexible ways of engaging with different groups if we want to hear their voices. And I think that's even more important for those young people who feel really excluded. Otherwise, we will continue to not hear them. Emma Sparrow, I'm going to leave your last response to you.
Oh, the last response and the pressure. So just to say that for us at RCPCH and us, we've got an equality impact kind of like assessment that we do for every piece of work that we get asked to find out what children and young people think, so that we then can think through who are the people that will be directly affected by this piece of work, who will be indirectly affected. And then we create a range of different engagement methods and models to then reach out so that we can get them all involved. And we work with universal children and young people, because they will all have something to say on something to do with health. But within our equality impact assessment, then we will also pick up groups like young carers or BAME groups, or children and young people in care, or have got, you know, different lived experiences. And then we will always do a focused piece of work with specialist voices who have very specific health conditions and health needs. But actually our approach to get in touch with them is all very different. So we do lots of community outreach, and even through COVID, we have been doing community outreach where, you know, we've been talking to them in the way that they prefer, and that could be through different partners, which is why for the mental health work, we commissioned different organisations that had contact to the most vulnerable so that they could be involved, rather than us expecting them to join a focus group or a workshop with someone that they don't know. And that way for us really helps us to build our diversity. So it is, for us, it's about being out, not having a you know, specific place where we want people to come to. We should go out to them. And then also then thinking, some people just want to tell us something for 5 minutes, and that's absolutely perfect. Some people want to join a session that might just be for 2 hours, and some people will want to join a project. So to have a whole range of opportunities, like you've already heard, so that actually there's something for everyone, but really thinking about what does that child or young person need. And some of that for us is with non-verbal children and young people. So it will be by using bear cards and widget symbols and sign language and, you know, interpreters and anything visual to make it work. So I think it's just about, like Emma said, you know, working with and Jeremy said, working with your local network, because a lot of them are already established. So we work with them to make sure actually they're able to feed their voice into national stuff.
Thank you so much, Emma. So I am gonna finish up now and do a few thank yous. And what I've popped in the chat is a bit of a kind of evaluation question about how people have found the webinar. We're really happy, if you don't want to put it in the chat, for you to send us that afterwards. But if you do have reflections on how you found it and what else you would like to hear from the work that we're doing together with others, then that would be really good. Hopefully you'll wave at me if you can't hear me. I'm just going to wave goodbye to my son. Bye. Now I've slightly been distracted, of course. It's half term. So I suppose, first of all, I wanted to say that one of the things that we often forget to say is that working with young people is completely inspiring. It's the best part of my work, and it's something that we really need to remember in organisations, because sometimes we see just the problems, and sometimes some of what the young people have to say is really difficult. But actually these conversations were also really a positive opportunity for those young people to have their voices heard, and they were really inspiring opportunities for everyone involved, I hope. I guess for me, there's kind of some key messages that we can all take on board. Speaking to young people directly is not a very difficult thing to do, and it's something that we can all do in engagement work and in our work in health and care. We really need to give groups of young people who are facing inequalities in the broadest sense, safe ways to engage around their health and find those opportunities. And we're really happy to support work in that area and organisations who are wanting to do that. I think the third thing is about access. Access to services is key. It's really key within the context of the pandemic. And we really want to avoid young people who don't have access to digital services feeling further excluded. And I think that's something that we've got to take on board and really think about how we're going to take action in that area. The fourth one, I guess, is about that context of young people's lives. When we are speaking to young people directly, we need to be thinking about every aspect of their life. If a young man who is a traveller comes at health services, and what he's really thinking about is the fact that he has no income because he can't access the benefits for whatever reason that he needs, that is going to be the most pressing thing in his life at that time. And so understanding all of those things that are happening in young people's wider lives is so fundamentally important to getting care right. And then I think the final thing is just having how important safe space is. And I think we can, this is not only young people, this is for all of us. Having a safe space to be is so important for our well-being and for our health. And for young people who we talk to, that isn't always home. And it is sometimes school, and it is sometimes youth clubs, and it is really important that for those young people who don't have safe spaces in their home environment, we are prioritising the keeping open spaces where they can be either online or in face-to-face, that they can be safe and well and can be looked after. So now, Jeremy, I'm going to ask you to put on the final slide with all the logos.
I wish I'd prepared a drum roll. Hold on.
Hey, there we go. Just to say, oh, you've gone to the end. Oh yeah, you're back. Just to say a huge thank you. So not everybody from all of the organisations we worked with could be here today, but I wanted to say thank you to all of our Young People's Health Partnership partners, and RCPCH for supporting the work, but primarily thanks to Richmond Carers, York Travellers Trust and Free to Be Alliance, and all of those local organisations came from the Health and Wellbeing Alliance partners, so the LGBT partnership linking with Free to Be, the Carers partnership linking with Richmond Carers, and Friends, Family and Travellers linking with York Travellers Trust. So without those networks and without those local organisations, this kind of work is not possible. So thank you so much. It's been delightful to work with you, and we look forward to continuing to work with you and everybody on this call. Our contact details, so if you want to find out more about what we do and other aspects of our work, we would absolutely love to hear from you. Actually, I just realised I forgot to particularly thank Tom, who was so brilliantly interviewed, and all of those responses from Tom, I think, really give us a detailed flavour of why this kind of work is so important, and why we really absolutely have to have both young carers, young Gypsy Roma traveller young people, and LGBTQ plus young people, as well as all of the other groups that we know need help, at the forefront of our work and our minds as we move forward. And thank you very much.